This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor.
So our Consult With Me today is about something that I just went through recently.
So it's personal.
Yes, but it's something I've heard from patients for years.
Yes.
Okay. So, and it's called Shards of Glass.
I think you've said enough.
Shards of glass. Think
Absolutely.
about that. Shards of glass.
Yeah.
So I want to talk about shards of glass because that was a 2-week, really pretty debilitating thing that happened to me.
I think we need to be a little more specific as how
I
you
know,
felt
but you're
this
the
guy's-
doctor.
Okay. So, and these weren't happening on the bus on the way home,
No.
was it? Okay. It was during sexual activity.
It was during sexual activity. It was mainly, especially after.
Mm-hmm. And it was a vaginal pain.
Yeah, but it felt very bladder. I didn't know if I was having a bladder infection. I didn't know if I'd injured myself. I felt it all the time. It wouldn't go away. I couldn't sleep. Yeah, it was really bad.
Right.
So I want to talk about that because people, when they call to talk about symptoms, that is what they say. Shards of glass.
They all recognize the description.
Yeah.
Absolutely. And it's amazing the number of women that I've seen over the last few years who have been unable to have intercourse because of pain. And they may have not had intercourse for 10 or 15 years.
Mm-hmm.
And they've because of pain. And it was about 10 years ago when we had our first treatment designed to address that, which is essentially a vaginal rejuvenation procedure of treating the vaginal mucosa with laser energy.
Really, if you're in that highly symptomatic state, you can't even do a procedure like that.
It would be hard, yeah.
Yeah.
Absolutely.
So I had to use the Interosa,
Right?
which is a
DHEA. It's a
DHEA.
hormonal supplement vaginally.
which is helping. What is that doing actually?
That gets converted to estrogen in the vaginal mucosa. It doesn't change your blood levels at all. So people who can't take estrogen for one reason or another are perfectly okay using it this way, getting DHEA, which converts. It can be produced or compounded by a compounding pharmacy, or it can be a prescription. It is always a prescription item, but a prescription designed specifically for that.
So if somebody's complaining of shards of glass, what is the treatment plan for them?
Well, first of all, usually pelvic rest, and starting probably a combination of estrogen or estrogen and progesterone vaginally, and that should be done at least every night for a couple of weeks, and maybe even longer, and that will get better. But intercourse stimulates it. It precipitates those symptoms, and so the treatment is ongoing. It's all due to lack of estrogen, basically, in the vast majority of patients. And the vaginal mucosa gets thinner, nerve endings are closer to the surface, tissue doesn't stretch as well, the collagen is diminished, blood supply is diminished. And so all those things need to be addressed in the treatment.
So basically, I'm officially old.
No.
And then when would you recommend a course of treatment? Like a vaginal rejuvenation treatment?
As soon as it can be tolerable, and honestly, depending on which technology is used, it only takes a few days, a week or so, to be able to do one of those treatments and to tolerate those treatments. They're not particularly painful. It's
That's
and
super
I recommend
easy for you to say.
recommend people do it as soon as they can. And sometimes, we can use, in addition to using estrogen, along with the laser, we could use exosomes, which would accelerate the healing.
Oh.
And that's another strong point for it, for the use of exosomes.
Why didn't you give me some exosomes?
It's a good question.
This is what happens, listeners.
Wow. Enough said. Thank you.
Thanks for listening. And if you have more questions, please let us know either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.